Good afternoon, this is Dr. Do again, and this is the special edition, quarantine special video number 3, talk about the metabolic syndrome. We already mentioned there are a couple of diseases belong to this category. Obesity is the one, and we have talked about that, the numbers to look for and the recommendations, strategies how to lose the weight. Today we're talking about another disease included in this metabolic syndrome, which you already know, you heard so much. It's called high blood pressure. What is the definition for high blood pressure? You know it. Different society, different doctors, different criteria. Basically, I prefer 130 versus 80. Okay, if you can lower than that, 120 lower for systolic and lower than 80 for the diastolic. That's good. That's especially for those. This is for those who has been healthy without any medical condition. If we have diabetes, the number could be lower, might be better. But you do not want the pressure too low. If it's too low, you have other conditions that might pose the risk for stroke. We'll talk about that later. So hypertension. This video is for general education purpose. So let's just start from the explanation for the blood pressure. What is the blood pressure? If you look at your chart, you see there's 140 versus 90/90. 140 refers to systolic, so when your heart contract, okay, cause the blood pressure is measured, and diastolic when your heart is dilated. That's how the number what the number means. Okay, what the impact for this high blood pressure? Everybody talk about this high blood pressure is bad. Why it is bad? Because the blood pressure is measure the systemic resistance to the heart. Okay, so if the blood pressure is too high, that means your heart pump the blood against the higher resistance. 1 day, 2 days is fine, but if it is long term, your heart always has to work extra force to overcome the resistance. So that's the problem. The heart will just keep working harder than normal, then cause the heart problem, ischemic. And heart itself has blood vessel to supply for oxygen. If you keep doing this, and high blood pressure usually associated with other conditions, so the blood vessel in the heart itself get ischemic. That's why the heart attack or myocardial infarction, because the ischemic, your heart vessel is not perfuse the heart very well, since your heart has been working so hard, harder than normal for such a long time, exhausted, and the blood vessel cannot, it's called coronary arteries, cannot supply the blood for the heart. So that's when the bad things happened. Okay, so how to prevent the high blood pressure? Usually, hypertension is genetic risk factors. So if you have family members have high blood pressure, so you have the risk. Doesn't mean you will have it, but you have the risk. Other risk factors, of course, you already know it: obesity, hyperlipidemia, the sedative lifestyle, not exercise regularly, and keep gaining weight, and the stress, etc., etc. There are many causes. Also, there's some systemic disease, for example, kidney disease or diabetes can cause associated with high blood pressure. So how to prevent it? Start from young. I think my recommendation to the young people, have a good lifestyle, limited salt intake, exercise, maintain good body weight, limit your fat, especially the unhealthy fat intake, and monitor your body weight regularly. I'm not saying you weigh yourself every day. Don't do it. It's just give you panic. Monitor it every day based on the BMI, especially when you're 40 years. When you're younger, BMI doesn't mean that much, particularly if you have body muscle mass. But when you're getting older, 40, 45 years old, you monitor your BMI and you realize your adipose tissue distributed in the waist So that's the time to alert yourself, monitor your body weight, exercise regularly to lose the extra weight, and limit the salt intake. That's the good strategy. And no matter how busy you are, how stressful you are, exercise every day. If you're very athletic, do the jogging, running, marathon. If you're not, just regular, or you just prefer slow, then just walk. Every day walk 30 to 40 minutes. Keep doing it. It's long term. It's better than one day 3 hours. Okay, a week for 5 hours or 2 hours. It's better than one day 3 hours exercise. Sometimes it's really maintain the regularity. Okay, and the other strategy is limit the salt intake. I know when you're young, you prefer the tasty food, but after you're 45 years old, 50 years old, you change this habit, not so salty. Keep plain, okay? And eat more vegetables, less meat, especially less carbs, okay? Maintain the good calories and healthy. All right, if you're a computer person, I heard many people said they're just sitting there the whole day. It's and very stressful. If that's the case, again, exercise, yard work, or doing physical activities is really good for you. Don't think, oh, I have to do the yard work, or I have to clean the room or clean the yard. But that's good for you if you take this as part of your exercise, and you will lose weight, maintain health lifestyle, and start early to prevent diseases. Okay. Next time we're going to talk about diabetes, and probably we'll add more on hypertension.